Well, joining me now is Rocco Blume from Plan UK. Thank you very much indeed for coming in. First of all, your reaction to this vaccine, that it appears to be imminent in terms of its being rolled out sooner rather than later.
Well, obviously it's a wonderful thing that this vaccine is being produced, and it's being, as we understand, being produced at a very, the testing is taking place at a very high rate, and it should be rolled out soon. That's wonderful. It will take some time for it to be used across the region, and the nature of the disease is that there's a crisis right now. So we think whilst it's a good thing, there needs to be still a very strong focus on the crisis at the moment. Do
you think enough was being done to develop a vaccine sooner rather than later, which could have prevented the deaths of all these people?
Well, the reason why we are in the situation we are now is because there wasn't a fast enough response early on in the crisis, and that would not have, a vaccine would have been maybe a part of that, but greater funding, greater response in prevention, in educating communities. If that had happened earlier in the year, we wouldn't be seeing the crisis we see now. So I wouldn't say that vaccine would have prevented the crisis that we have now.
Now let's talk about the minutiae of all of this, because Ebola appears to be affecting the genders differently, women different from men. Why does it appear to be having a bigger impact on women?
Well, this is very true. Plan International works with children, and we work with adolescent girls across the region. And what we have been seeing is that girls and women are disproportionately affected by the disease. Girls and women are the primary caregivers, so they come into contact with people who've been infected. There's a greater risk of exposure. But also we know from our research that in humanitarian crises, women and girls are exposed to other risks, like child marriage, early pregnancy, and dropping out of school. It's a lot more difficult to re-enter school if you've been through those experiences. So these are the things that are really affecting girls.
So education is key then in places where this Ebola epidemic is taking hold?
It is key, and the tragic thing is that because of the nature of Ebola and how it spreads, schools have been closed across the region. And in Liberia and Sierra Leone, around 3.5 million children are out of school at the moment because of this. So we have children that aren't in school. They have limited access to educational materials, and they have greater exposure to some of these other things. And it's more difficult to get back into school. If you've had to drop out for a year or so, it's more difficult to get back in.
And that's where your organisation, Plan UK, comes in?
Yes, absolutely.
Tell us about what you're doing there in Sierra Leone.
Well, we are responding to the disease itself, so we're working with communities that have been quarantined. We're providing materials, non-food items and so forth, because people aren't able to get out to food markets and to other markets. But regarding education, we're providing home schooling packages. We're supporting the radio education programs that are being run by the governments and UNICEF, but also we're trying to provide girls with sexual reproductive health education and information that will prevent them from falling prey to some of those problems I mentioned earlier.
Now, meanwhile, reports coming out today of Ebola cases on the rise in Guinea. I mean, this may not be your province, but why do you suppose that is happening? I mean, one would have thought that with all the information going out, it will be coming down, not going up.
Yes. It's a very unpredictable situation. We've seen a recent slowing of the spread in Liberia, a continued increase in Sierra Leone, and as you say, a decrease in Guinea. It's very hard to say why. When the disease spreads, in some places it will rise, and other places it will fall. It's very unpredictable to know why it's moving around. But the general response, if it is kept at the current rate, if there are good education programs, if there is good disease control, then this should bring the overall level of the disease down.
OK, Rocco Blume from Plan UK, thank you very much indeed for coming in.